The first step in collecting any quality ECG is placing the electrodes in the proper location on the patient's chest. Always prepare the skin by cleaning and shaving the electrode locations to assure a quality ECG tracing. The skin should be cleaned with soap and water right after the hair is removed. Then it should be dried with a towel and rubbed repeatedly with a gauze pad. This should result in a mild redness of the skin, but the skin should not be bleeding or broken. Be sure the patient cable is hooked up to the snap electrodes ahead of time. This ensures that you are not pressing down on the patient's chest while connecting the patient cable. Start by locating the fourth intercostal space to the right of the sternum to place the V1 electrode. Finding the fourth intercostal space is where most technicians fail and get bad positioning, usually one inner space too high. The technician should find the angle of Lewis. It is a horizontal lump that traverses the sternum horizontally, about 2 inches below the suprasternal notch at the top of the sternum. It is easy to find. It articulates with the second rib, so immediately below this level is the second intercostal space. Find it and track down from there to the fourth intercostal space. The V2 electrode is placed directly across from V1 to the left of the sternum. Next, move down one intercostal space and locate the mid-clavicular line. This is usually directed below the nipple. Place the V4 electrode here and then place V3 directly between V2 and V4. Move horizontally from V4 and place V5 at the left anterior axillary line and V6 at the mid-axillary line. With the V leads in the proper position, next place the right arm electrode and left arm electrode on the fleshy part of the inside of the arm close to the torso. Finish by placing the right leg electrode on the sternum between the second and third ribs. Then, place the left leg electrode on the left side of the patient's ilium or hip bone. Refer to the drawings and written descriptions in the operator's manual, which clearly outline proper electrode positions. Note that the lead wires are labeled by color and include a lead identifier to aid in proper placement. Press the button quickly and you will see a number 1 through 9 which indicates battery life. 9 indicates that the device is fully charged. Press and hold the button to turn off the device in order to preserve the battery in between uses. To charge the device, plug the USB cable into the USB port and plug into your computer or wall charger. Now we are ready to record the ECG. The clinician connects the ECG cable to the device and checks the LED status window to verify that the P is in pairing mode. This means that the signal quality is good and you are ready to acquire the diagnostic 12-lead ECG data. In the upper corner, you will find a 10-second button and a rhythm button. The 10-second button allows you to record 10 seconds of an ECG. The rhythm button allows you to record up to 5 minutes of an ECG. The settings icon allows you to adjust the display on your screen. Press the 10-second button. The app will always record the previous 5 seconds and the next 5. Once the 10 seconds is up, you will either view or delete the ECG. Click View ECG Data to continue. Once you view the ECG, you will be prompted to enter in the patient demographic information. This information will either be populated ahead of time with the web ECG software, or you can simply enter it when you are with the patient. The demographic information is customizable, but at a minimum, you will need to record gender and the date of birth in order for the algorithm to provide an analysis on the ECG. Make sure to select Done to complete the demographic entry. Then click Save. Then Yes. Click Get Report in the upper right-hand corner to send to our cloud-based server for algorithm analysis. You'll see an icon appear that says Awaiting Report. This is also the moment in which your automated workflow is being enacted. Now you will see the report on your device. In the upper left-hand corner, you will see the demographic information. And in the upper right-hand corner, you will find the unconfirmed ECG interpretation. You can go back to take another ECG or move on to further workflow.